Understanding Hypothyroidism and Hyperthyroidism, a comprehensive guide. The thyroid gland may be small, but it has a big job. Found at the base of the neck, this butterfly-shaped gland produces hormones that affect your metabolism, energy levels, and many other important functions. When the thyroid is not working properly, it can cause two common conditions. Hypothyroidism happens when the gland is underactive. Hyperthyroidism happens when the gland is overactive. These problems affect millions of people across the world. Their symptoms are often confused with signs of stress, aging, or other health issues. This guide explains how the thyroid works. It will help you understand what hypothyroidism and hyperthyroidism are, what causes them, how they are diagnosed, and what treatments are available. Whether you are facing thyroid problems yourself, or simply want to learn more, this guide offers clear and helpful information. The thyroid is a small gland located in the front of the neck. It produces two key hormones called thyroxine and triiodothyronine. These hormones help control your metabolism, body temperature, heart rate, digestion, and even your mood. The brain helps control the thyroid through the pituitary gland. The pituitary sends out a hormone called thyroid-stimulating hormone, or TSH. When thyroid hormone levels are too low, the pituitary produces more TSH to increase hormone production. When levels are too high, it produces less TSH. This system helps your body stay balanced. Hypothyroidism means your thyroid is not making enough hormone. This causes your body to slow down. People with hypothyroidism may feel very tired, gain weight, and feel cold even in warm weather. It is more common in women and often appears with age. The most common cause of hypothyroidism is an autoimmune disease called Hashimoto's thyroiditis. In this condition, the immune system attacks the thyroid. Other causes include thyroid surgery, radiation treatments, certain medications such as lithium, a lack of iodine in the diet, or problems with the pituitary gland. Symptoms can develop slowly and may not be noticed right away. Common signs include constant fatigue, weight gain, dry skin, feeling cold, depression, constipation, thinning hair, slow heart rate, poor memory, and heavy or irregular periods. Doctors use a blood test to check for hypothyroidism. A high TSH level suggests the thyroid is underactive. A second test, called free T4, shows if your hormone levels are low. If the doctor suspects an autoimmune cause, a test for thyroid antibodies may also be done. The main treatment is levothyroxine, a synthetic hormone that replaces the one your body is missing. It is usually taken once a day, ideally on an empty stomach before breakfast. Some other medications or supplements, such as calcium or iron, may affect how your body absorbs it, so they should be taken several hours apart. Most people need this medication for life, with regular blood tests to make sure the dose is correct. With the right treatment, people with hypothyroidism can feel better and live healthy lives. Hyperthyroidism is when the thyroid makes too much hormone. This causes body functions to speed up. Although it is less common than hypothyroidism, it can be more serious if it is not treated. The most common cause is Graves' disease, an autoimmune disorder that makes the thyroid overactive. Other causes include thyroid nodules that produce extra hormone, inflammation of the thyroid, or too much iodine in the diet or in medications. Symptoms of hyperthyroidism include weight loss, despite normal eating, a fast or irregular heartbeat, nervousness, sweating, shaking hands, trouble sleeping, sensitivity to heat. People may also notice frequent bowel movements or bulging eyes, especially in Graves' disease. To confirm hyperthyroidism, doctors check TSH, T3, and T4 levels through blood tests. TSH is usually low while T3 and T4 are high. Other tests may include checking for thyroid antibodies or using a radioactive iodine scan to see how active the thyroid is. Treatment depends on the cause and severity. It may include medications such as methimazole or propylthyracil to slow hormone production. Another option is radioactive iodine, which shrinks the thyroid. In some cases, surgery may be needed to remove the thyroid. Beta blockers may also be given to help control symptoms like fast heart rate. After treatment, some people develop hypothyroidism and need lifelong hormone replacement therapy. Living with a thyroid condition means managing your health daily. With the right care and follow-up, most people with thyroid problems can feel well and live full lives. Regular checkups are important. Blood tests are usually needed every 6 to 12 months to make sure your hormone levels are stable. Your doctor may adjust your dose as needed. Healthy eating also supports thyroid health. For hypothyroidism, eat foods high in selenium such as Brazil, nuts and seafood. Limit raw cabbage, broccoli, and other cruciferous vegetables as well as soy-based foods, because they may interfere with thyroid function in large amounts. If you have hyperthyroidism, avoid too much caffeine, which can increase symptoms such as anxiety and a rapid heartbeat. Make sure to get enough calcium and vitamin D to keep your bones strong, because too much thyroid hormone can cause bone loss. If you feel tired all the time, notice changes in weight or mood, or have irregular heartbeats, talk to a healthcare provider. Thyroid problems are very treatable, especially when caught early. Hypothyroidism and hyperthyroidism can affect how you feel every day, but with proper care, they are manageable conditions. Blood tests, medication, and healthy lifestyle choices can help you stay in balance and live well. If you think you may have a thyroid issue, or if it runs in your family, ask your doctor for a simple blood test. Early treatment can prevent serious problems and help you feel your best. Your thyroid may be small, but it plays a powerful role in your health. By learning about thyroid function and staying aware of symptoms, you can take control and stay well informed. If you're curious about the latest breakthroughs in the world of pharmaceuticals or want to learn more about how common medications work, subscribe to Drug Insight Hub for in-depth drug breakdowns, market trend reports, and expert insight.